I'll wait for your prompt.
No problem. Here we are.
Okay, thanks, Chris.
You're welcome. Thank you. All right. Okay. We're at 73 people now, Joe.
Wow.
And we'll just start. I'll give it 1 minute and we'll get going.
Okay. My voice is good. You can hear me fine?
I hear you. Do you hear me fine?
Yep. A little bit of an echo with you, but I can hear you.
I'm in an empty room. Okay, hello everyone, and welcome to today's webinar. My name is Chris Marty. I'm the VP of Data Analytics and Executive Education at MSCI. Before we get started, I'd like to go over a couple of housekeeping items, and I want to show you how to participate in today's event as well. So you're seeing a screenshot of the GoToWebinar interface, and you are on computer audio by default using Zoom. You can switch over to a phone call if you'd like by using the audio settings down in the lower left-hand corner of the Zoom interface. And while Joe and I are talking today, you can ask questions, and we hope that you ask a lot of questions using the Q&A interface in Zoom, and you see that on the picture here. And please don't hesitate to ask questions at any time. We will answer them as we go along today. Today's session is going to be a discussion. It's not a presentation. So we're going to rely on you to have some cogent questions. Thank you for doing that. And now I'd like to introduce Joe Galasso. Joe is the Corporate Director of Health, Safety, and Environment for Samuel, Son and Company Limited. Joe's been with Samuel for over 30 years, and he started his career on the shop floor and has held operational leadership roles in both the US and in Canada. Joe's been a safety advocate throughout his career and in a full-time health and safety leadership role since 2000. Joe is a certified train the trainer for behavioral safety, and his current role includes responsibilities for approximately 80 locations across North America. Joe's one of the founders of MSCI's Health and Safety Committee, although Joe might tell you he's more of a victim of that than a founder because he's put so much effort into it over the years. Joe, welcome. Thank you for doing this for us. Looking forward to this conversation.
Thank you for the really nice introduction, Chris, and I'm looking forward to talking to my peers as well.
Yeah, I think
and listening.
All right, so let's get started. Let me ask you first, real quick. Did I get your bio correct? Is there anything you'd like to correct me on or add?
Nope, that was it in a nutshell. Lots of training, union executive at one point as well, so both sides of the spectrum. So nope, you set me up well there, Chris. Thank you.
Okay, you're welcome. So we mentioned in the promotion for this event that you had experienced the SARS epidemic as well as this current COVID-19 pandemic. Can you talk a little bit about what the differences between those two epidemics are, just to fill people in on why one set of experiences, I guess that was what, 15 years ago, would be relevant today?
Sure, Chris. So again, in my opinion, on the SARS compared to the COVID, same family of viruses, by the way. I think the SARS issue from when that came, and you're right, 2003, we saw more of an interest in Canada than I think our friends in the United States did. And I think the biggest difference with SARS compared to this virus is the word that was added to COVID, which was pandemic. So in 2003, when we dealt with the SARS issue here, that word wasn't attached. So that in itself, I think, is a very significant difference. And I think if you look at the time in 2003 compared to where we are today, social media, the phones that we have, the technology we have now, significantly different. We were still in the early stages, I think, of a BlackBerry and things like Facebook and Twitter and all of those things. If they weren't in existence, they were just starting to get popularity. So I think that's one of the key things now is the influence that we're bombarded with social media-wise and information, whether it's correct or not. For us here in Canada, again, all due respect to our friends south of us here, it really didn't get a lot of attention from my recollection. We had some of our locations that were conscious of, drivers coming into the U.S. out of our service centers here in Southern Ontario and concern about them coughing or being sick. And we dealt with those kind of on a one-on-one situation. But it definitely did not get the media attention or the focus that the COVID globally is getting, and that, I think, is the biggest difference, Chris.
Okay, well, that makes sense. And it was some time ago, and I think you're probably right. The communications technology is vastly different these days. So let me start into asking a series of questions on more or less what I would call our current situation. Where do you at Samuel get your advice on the regulatory parts of the COVID-19 pandemic, best practices, just information on how to do what you would normally do in a situation like this? Where are the places that you guys go?
Okay, sure. So again, actually, to follow up to your first question, having gone through the SARS, we know that information or resources to get viable, accurate information. And one of the hangovers from the SARS was we utilized things. We did look at the WHO information, but we focused primarily on the Center for Disease Control for the U.S. and here in Canada, we were utilizing the federal government site, Health Canada site, and there's parachutes of that as well, different offshoots, but those were our primary reliable sources of information. We found them to be credible, updated on a regular basis, and they didn't tend to get caught up in the politics of the situation. So that's where we started. In this case, Chris, what we did, looking at what was occurring outside of North America back, early or late 2019, and we were monitoring. I think a lot of people were aware or conscious that something different was going on out of China.
Yep.
So we were monitoring some news resources, through Google, doing a search on it. And so we looked at, again, there was a document that we found that was from Taiwan. And, again, looking at countries that manage this thing or kept things in check and did a pretty good job of it. So we started looking for resources where they were front line, already dealing with it, and what was out there. And there wasn't a lot originally, but that's what we did. So we were looking for sources out of the regions, and of course, China being a country that doesn't necessarily share a lot of information for whatever reason. But we were looking for that kind of guidance and feedback. So, our group was starting to, look and read and gather information. And, typically we do a flu and health newsletters and every flu season. I'm sure a lot of my peers are on the phone do the same thing. So it was just, again, going back to those reliable sources as a starting point. And that's what we did.
Okay, so it sounds to me like, just to sum up, that government resources in the public health field are what you guys rely on, not news media as much. You're really trying to take the politics out of it and get to the public health information. Is that a good
right?
Summary?
And I just think CDC, yeah, exactly, Chris. CDC is been around, and I've always, again, we found their information to be credible and useful. And Health Canada, of course, is our go-to for here. And they've taken the provincial, each province has their own health reference information as well. And we look at that too, but take it try to get to the top of the house and go from there. That's how we did it.
Okay. So I'm going to bring up one slide that I have that you and I can talk to a little bit. We have a resource that we use at MSCI when we do our annual surveys for our members. That industry is called Industry Insights, and in fact, they've done our annual safety survey and our compensation surveys for a long time now. And they've been surveying a bunch of companies in the distribution and manufacturing sectors. And their most recent survey was released just last week. And this slide shows you what the top 10 actions put in place are due to the COVID-19 pandemic. And you and I looked at this briefly before we started talking. What was your first comment when you saw this?
Well, I was surprised that it wasn't 100% on a lot of these. And, I understand surveys don't always capture, what people are actually doing, but I was surprised that at a few of these, Chris, as you mentioned, because that's 101 stuff. A lot of these things a lot of you have been doing, and again, we were out in front of early on, and they're the basic 101 stuff that, again, if you look at government, CDC guidelines, et cetera, they talk about the significance of having these things in place. And we firmly believe that that's helped us minimize the exposure and the hazards around this whole thing from day one. Having, like I said, the hand sanitizer and getting out in front of that. We knew that was going to be a challenge. And, we promoted. Now, it hasn't been perfect by any means with Samuel, but our whole team was on side and aligned with getting this out. We communicated that out right in January. Our leadership group, again, right behind and in support of all of the things we've been doing, canceling, the large group activities. And again, what does that mean in the format of the questions you asked? I don't know, but physical distancing. Again, we've been fortunate. We're not assembly line in 90% of our locations. Distancing wasn't a challenge, but I can understand in some it would be. Daily cleaning and sanitization, again, doing that and having people doing that function we've had in place. It's also, a component of the mental health. People see that this is being done, and it just reduced the background and the questions about, what if so-and-so coughed on this or somebody touched that. Okay. Reminders about hygiene, simple. What's your protocol look like? What's your proper hand washing and sanitation? Tons of posters readily available, even through OSHA, through CDC. Don't cost anything. Simple. That's 52%. that's concerning. Visitors to the office, yeah, I mean, most of our facilities, we're, where we can work from home. Obviously, the shop floor folks can't do that. But yeah, no visitors to the office. That was put in place pretty quick by our leadership team as well. In person, same thing, using technology like we're using today.
Yep.
Travel ban, yep, absolutely. That was put in place very quickly by us, and minimizing that. Flexible work schedule, kind of working with home, same thing. We've, I think we're in our 6th week of anybody who can work from home has been told to work from home, and where Samuel stands on that is it's the same right now in place until the end of this month.
Yeah.
So kind of interesting that some of those are pretty low.
Yeah, there's a couple questions people are asking about that. So in one case, they're asking about the date of this survey. It was the middle week of April. So this is fairly recent, 2 or 3 weeks of information. And by the way, I will share this slide with everyone after the webinar. So if you're interested, in fact, I'll share the whole slide deck of this industry survey with everyone. So you'll see some of the other stuff that was in that survey as well. But the companies that were included in this survey were distributors and manufacturers. It doesn't go beyond that as far as I know. So it is interesting that some of these percentages are so low. So you mentioned the word leadership a couple of times. How important is leadership in making sure that these things happen the way they're supposed to happen?
Sure. Well, in all things, Chris, I think the standard answer, you know what I'm going to say, is it starts there. We were fortunate, or we are fortunate, that this was taken seriously right from January. Our leadership group from top of house, has been progressive. Obviously, the thing was so fluid, and it progressed from a general communication when we first started back in January to adding everything from a one-stop shopping for everything COVID related, which we created on our internal learning platform. Daily, well, not daily, but they have daily calls at the top of house on the situation. They've been doing that for a couple of months. There's been leadership messaging coming directly from Colin Osborne, our CEO, and other leaders, Gary Strickland, everything from, ask questions, feedback on COVID, how we're doing, that type of thing, direction on why we're doing what we're doing. So there's huddles, there's been, broadcasts right across our company. There's Colin's messaging, and that's updated sometimes twice a week, depending on what's going on. Gary Strickland, HR, has put things out about mental health. So it's been all hands on deck. I think it started at the top of the house. It continues to be led by the top of the house.
So
and
they're leading the charge.
Yeah, everything there, and it's. I think it's helped us immensely get the the whole COVID thing under some control, for lack of a better word. And but yeah, starts from top of house, so fully supported. And again, I'm pretty fortunate. I'm surrounded by some really good people, and the ops guys, everybody, the ops people, everybody's done a fantastic job of supporting that. And again, because senior leadership's out there, it made it easy for us.
Yeah. So there's a couple things I don't see on this list, which surprised me, and I wanted to ask you about that. Personal protective equipment doesn't really show up here, and I'm a little bit shocked by that. But can you talk about what kind of PPE you guys are using and how you source all that, and if you've had any trouble sourcing things like that?
The $1 million question.
Yeah.
So again, the PPE has been a challenge. I think most of us on this call will be nodding along going, yeah, tell me about it. How do you get it, et cetera. So we, again, back in January, we put out some communication about through SARS, knowing that we might face masks or, N95s or whatever you were utilizing on a regular basis, to make sure that you stock up on that. Same with hand sanitizer. We mentioned gloves briefly, again, just for medical purposes, because again, we figured those things would get in the shortage. But the mask and face covering thing, the biggest challenge we've had with that, and then we actually have just decided as part of our revamp to implement face coverings and masks next week as we slowly open up a little bit here. But our biggest challenge on that, honestly, Chris, has been the, again, political situation, some decisions and things that were put in place by the governments, more on the U.S. side than here. Ad hoc, all of a sudden the next day or 2 days later, they're changing their mind and now saying you have to have a face covering on or a face mask or this or that. So it's been difficult.
Okay.
We've had, again, pockets in the U.S. where it came out of nowhere, and we had to respond. So obviously the shortage of N95s, even where we have the odd application where, because it was part of our PPE on a specific task, we've had scrambling with that. Face coverings, finding that type of equipment, as you all know, it became very, very hard to find. You were getting mixed messages that don't buy it because you need it for the medical profession.
Right.
But we did go to the source, Chris, very quickly. Again, we went right to manufacturer in Taiwan, and this would have been back in March. And we ordered directly from, because our partners, our Fastenals and our Auckland's Grangers, they just got depleted. And I think everybody on the phone, their local suppliers probably ran up very quickly too.
Sure.
But we went right to the source. And again, it wasn't perfect. It took, the delivery date was a little skewed. And of course, with all the other things that were going on, there was all of those exposures that made it more difficult to get the stuff in. But yeah, we're the PPE stuff. We amended our corporate minimal standard on PPE to include face covering and masks for temporary. That goes into effect May 11th across our organization, office and plant. But that's a temporary amendment.
Okay.
So that's what we're doing.
Okay, so let me ask you a question, and I don't mean to stump you, but I think depending on the folks on the call and the company they're with, Samuel has scale. You're a fairly large company, to say the least. And if you had trouble getting this kind of thing, I can only imagine what smaller regional or even local distributors might have had. Do you have any suggestions for them on how to source some of this stuff? Or is it just a matter of having to just beat the bushes like crazy to find it?
Yeah, and I understand your question, Chris, and it is tough, I think, for you're right, locations that don't have a procurement team or don't have their standard, they're partnered up with a small supplier locally, which is, the norm in many, many cases. I will say that I think the masks and other PPE is becoming more available now.
Okay.
I find up here it's been interesting, and again, I live in a small community. We don't have, there's a couple of hardware stores and things like that, but it's not, we don't have a Walmart or anything even like that in my town. But I found that, in my local variety store had masks and hand sanitizer, and they've had it through the whole thing. So it's kind of interesting. Now you're going to probably pay 10 times or 20 times more, unfortunately.
Right.
But I think, if it is becoming available, I would, again, caution, you're probably getting lots of emails from companies that are pushing their, they've got all kinds of, supplies and everything else. I would just caution that the delivery date may be out of whack. So I don't have any other guidance.
Okay.
I do think it's becoming more available. Again, the hand sanitizer issue in itself, with all of the U.S. distilleries that have quickly turned around and are making that. That's kind of fallen off. That was a very hot item. I think wipes are still in some short supply, sanitary, the Lysol type stuff, but there is other options available for approved cleaning solutions and things you can find on the CDC site, and OSHA even has a direction on cleaning supplies and things of that nature that you can utilize, bloodborne pathogen type cleaning solutions. So that would be my guide back to them.
So back to the reliable government public health sources, basically. There's a couple of questions about screening of employees. Are you guys doing any temperature taking and things like that as people enter the workplace? Do you do it just once? Do you do it periodically during the day? And what other kinds of screening are you doing as you have been going along, or as you said earlier, talk about ramping up a little bit in the coming weeks?
Sure. So our biggest thing, again, comes back to our early communication about the signs, the symptoms, the safe practices, all of that. And, part of our communications that we've done 2 very specific sort of safety talks on this situation, along with all the other information that has been, captured and put into our business continuity plans, et cetera, around temperature monitoring. So again, self-screening, making people aware of what the symptoms were or are around COVID. Our message has been from day one, if you're sick, stay home, as well, which has been, we haven't deviated from that at all. We've looked at temperature take. We have something in our pocket. We looked at the thermal guns and all of that, but there's quite a bit of protocol you have to put in place to do that. We looked at it again through the CDC guidelines of ranking of far as, exposure, and that our business is, we're not a medical, we're not food. We're at the very bottom of their guidelines as far as looking at that process. So we have something in our pocket if we decide to do it, Chris. We're exploring, the future as well. What are we going to take away from this thing going? But currently, no, we are not taking people's temperatures. It just creates a whole other level of exposures. We'd have to implement quite a bit of process to do so. Now, there is other technology, thermal cameras, all of this. Again, we've been looking at it. It's interesting. It's expensive. But is it something long-term that we would need to do? The one thing that we did get, and again, we have available because, again, we haven't promoted it, but we do have disposable thermometers that were mailed out to all of our locations back in early April, just to have on hand in case we had a situation that, went along with our whole protocol if someone's sick in the workplace, what to do. So that's where we are on the temperature taking exercise.
Okay, thanks. Do you have any kind of written infectious disease control plan or anything like that? Is that something that you've ever thought of doing, or maybe you have one?
So it's interesting, Chris, because when we went through the SARS situation, there was discussion about creating a whole protocol for that, but it kind of fell off the page. I can tell you that we are working on what we're going to call a pandemic planning guideline for next time, because the likelihood is that we're going to have other exposures like this come into our workplace, and I think businesses need to be prepared for that. Whereas before we kind of went, it's not going to happen again, and we kind of shrugged it off. So we are working on a guideline specific to that, Chris. I think if you don't already have part of your business continuity plan, something, whether it slots in there or not, but we're looking at a kind of a stoplight approach. We use stoplight guidelines for, capturing all kinds of different things. So early stages, it's not something that we're, going to have ready tomorrow, but I guarantee we will have something in place for this by this time next year for sure, so we don't get caught off guard again. And I think you're going to find that there's lots of you're going to see lots of this stuff become available. Some of it's going to be free, and some lawyers are going to charge you for, and you're going to have consultants calling you, and you're not already. You're going to be inundated with all kinds of guidelines and everything. But yeah, we're working on it, Chris, but nothing that we have ready today.
Okay. So there's a whole bunch of interest, both in questions people are asking now, and frankly, I have this in my head too. I want to talk for a minute about individual employees and how you handle various scenarios. So if somebody comes to work and gets sick at work, or if somebody comes to work and has a fever, how do you handle those situations? Do you send them for testing? What is the protocol that Samuel has in place to deal with that?
Okay, sure. So what we created very quickly was one point of contact for anything COVID related, and we formed a team, and that consists of EHS, HR, and a senior operational leadership. So we've had a handful of situations where we had something like that happen. An employee comes into the workplace and they don't feel well. So again, part of our planning was we set up a process where the employees immediately, obviously taken off the shop floor, put in a isolation room or designated isolation room. So we try to get them out of the facility as quickly as possible. If we had, symptoms that were showing up related to COVID, we'd give them a mask. Get them out of the facility, tell them to go get medical attention, and follow the regional, because again, in the US and Canada, there's certain protocols that needed to be followed. To follow that direction, keep us informed of how they were doing. Then we would go in and sanitize the room or anything that they had been touching, along with, again, what we were already doing, but we would come in and do an extra clean of anything they've been in recent contact with. So that's how we handle it all the way through.
If you've had someone who has, in fact, been tested and was tested as positive, how do you deal with them coming back to work? Do you have a quarantine restriction, time constraints? How do you do that?
So we've been going, So Chris, good question. We've been following, again, the guidelines from CDC on that, and the regional. So it's the 14-day quarantine. And again, this thing has changed and modified and morphed many, many times actually in the last little while, because as we know, fever isn't always present in many, many cases around the COVID. Once we have, that's 14-day, obviously doctor's notes are hard to come by. So we're, again, shared responsibility with all of our employees. We make it very clear what the expectations are. Same if, somebody has somebody at home that's been tested positive, then it's, they go into the 14-day quarantine. Same thing, making sure that they're following the guidelines. Now, in some cases, we've been able to get confirmation that, they've been tested, and, here's the employee shared it with us, and it's been negative or it's been positive. Okay. And then we just follow that. But again, as you all know, it's almost impossible. It might be easing a little bit today. I don't know, but it's very difficult for people to even get into hospitals, et cetera. We had to amend our insurance provider direction to go to virtual as well, because if someone was injured or, you were sending them for a drug test or et cetera, how are you going to do that? So we had to modify our temporarily our partnership with travelers to put in a virtual clinic, because again, you're trying to send people to get looked at. They may not even let them in the hospital. So we've been just relying on our people to support what we're doing, and they have been. So we've been very fortunate.
Do you do anything special if you have an employee who tests positive and has been in one of your facilities? Do you ask other folks who work around that individual to go for testing, or how do you manage that?
Sure. So again, we've had a handful. So again, our committee, immediately when we become conscious of any situation, there's an immediate call that we discuss all the facts. So we get a trail, when the employee worked, who they were in contact with.
Okay.
All of those things. We get all that information, and then we make a decision. We obviously have to notify employees that could have had potential contact or within any violation of the protocol we have about the 6 feet and all of that.
Okay.
And then that's communicated to them, and then our message has been, you monitor yourselves for, because it's typically 2 to 7 days. And if anybody is uncomfortable or whatever, we will make what we can or what we can do specifically to, maybe there's a way that they can take time off, et cetera. But we've dealt with it case by case. Yeah. Okay. And again, it's worked well so far.
Okay, so I have a question that's I personally find interesting. There's two words I hear in relation to cleaning facilities. The first word is disinfect, and the second word is sanitize. And I'm interested in what your definition of the difference between those two things is, and how do you go about cleaning a facility if you've had an employee working in that facility test positive, or just in general?
Sure. So I'm not a medical professional, but I would say I think sanitize has got kind of mixed in because of the hand sanitization aspect. Sanitize is a pretty big thing. I think let's start. I can only talk to what we're doing. So we have the sanitizer products. That's throughout our facilities. It's at entry points. It's by bathrooms. It's in all those areas. So the hand sanitization stuff is there. The cleaning, we're utilizing, again, products, off-the-shelf products that we typically use, and or approved substances that have been endorsed by Health Canada, OSHA, CDC. So that's what we're using. When it comes to where we've had, and Chris, we're walking around, literally, we got people doing it, spraying down vending machines, cleaning our cafes. So we've extended, wiping doorknobs, wiping bathrooms, wiping any frequently touched objects. We have people doing that. So I would call that sanitizing. I think when we get into what we've done where we've had a potential COVID issue is we will do the same thing. However, depending on the case, we reach out to an external company to come in and do it. And even though you're not mandated necessarily to do that, there's a peace of mind that sends out. The message sends out to all of our employees that we're taking it seriously. Okay. So in some cases, we bought in now, this could be from our regular cleaning service, because we didn't talk to them about enhanced cleaning as well. But if we have where we've had, a handful of COVID concern, we've bought in an external service to do a deep clean. And that's been our process.
Okay. All right. That makes sense to me. Social distancing. You mentioned the 6 foot. That's the most common rule that I've heard is 6 feet. Is that something you're trying to enforce in all your facilities?
Yeah, we again, yes, Chris, in Canada, we have to say 2 meters. And it's funny because it's 2 meters translates to 6 feet, 6 inches and 3/4. So I've had people actually call me and say, you're not being specific. But yeah, that has been, again, one of the things that was really early put out about, and there's all that speculation about how far droplets can go and the coughing or sneezing and all of that stuff. But that seemed to be the general direction as a safe zone, if you want to use that term. And that's what we've been practicing. And so that involved things like, and, our operations team had to be, we've got empty offices. So for the most part, that's been simple. But for our ops people, we had to look at our change rooms, our lunch rooms, how do we maintain that distance? And in some of our locations, it's quite a challenge. If we have a couple hundred shop floor people and, they used to have lunch all together at X time, we've had to stagger that. Change rooms, punching in and out, scanning in and out, all of these things, all of our operational team had to take a look at, and it wasn't one size fits all because we have different size locations that do different things. But all of those things, absolutely. Some of our locations went to the point of putting markings on the floor, and in areas where we were having challenges around that. But again, it comes back to early communication, supporting what we have in place, that 6 feet barrier thing. It's funny, when we first started, people were encroaching. And now I look at it even when I'm here and I'm engaging with somebody in the shop or one of the GM that's here, or again, a handful of people, it's standard. We're stopping 6 feet apart or even further apart, depending who you're talking to.
Sure. Yeah, makes sense. I'm curious, and there's a couple of questions about truck drivers. So you no doubt have your truck drivers who are going out and getting in contact with customers, and you've got suppliers and contractors coming into your facilities. Anything special you're doing there? There's got to be a lot of training involved in those interactions, aren't there?
So the trucking aspect, again, we've had some states, some of you on the call will know what I'm talking about, New York State, where we had to give masks to our drivers, and I believe Mr. Como also wanted them to have gloves on, which most of them had gloves anyway. But it hasn't really crept in too much, Chris. I mean, we've got, again, we're getting ready for this because part of our mandate, May 11th, is going to be everybody. So we're setting up where we're going to have masks available or face coverings available for drivers that come into the property. And we're looking at all the different things that impact that too, communication, safety. We don't want the mask or the face covering to create a safety issue. So we're just, again, rolling that out. We haven't had, other than legislated, on the U.S. side about masks, and we've had a couple of customers that have said, hey, we want your drivers to have masks. So we gave them to our drivers. And again, that's how we've been dealing with it. And I mean, some of you may be getting questionnaires or specific mandates from customers of protocol they want you to have in place. And of course, if you're going to go and do business or deliver steel there, then you have no choice but to really follow what they're asking you to do.
Yeah.
So, we give our drivers now we've got hand sanitizer. We're just actually putting together some kits and adding some extra things in right now that as we get ready for May 11th. PPE kit for drivers, and even we have service technicians that we're looking at as well, making sure they have all the proper equipment.
Sounds like May 11th is a kind of a big deal to you guys then, which I think
for us, yeah.
Okay.
Yeah.
Shift change. How do you manage shift changes now? Because you've got a lot of people mixing usually during those times.
Yeah, we've where it's been an exposure, we've staggered it. So we've extended a grace period. That's one example of how you can do it. We've looked at, most of us have the swipe cards, like the credit card type scan in or fob type thing, and we've eliminated that. We've put people on like an honor system. So that's how we dealt with that. And again, depending on your relationship, whether you're unionized or not, all those things, you got to hash it out with your employees. And but that's what we did with that. We again, where we needed to, we just offset start times and gave a grace period in between one shift to the other.
Okay. Have you guys? You mentioned this before, and I just want to make sure because there's a question here. It's pretty specific. Have you closed your break rooms, or are you still allowing employees to use break rooms given that they adhere to certain distancing standards?
Yeah, I'm not conscious of us closing any break rooms. I am conscious of changes, so, the social distancing and then staggering of some breaks, but I'm not conscious of us closing any of our break rooms.
Okay.
And it's, you've got to remember that, you don't want to start changing so all of a sudden now it's safe to eat in the shop floor when, before you had a policy that you didn't. And, I think trying to keep things as normal as you can is another key thing. And, the weather, obviously now we're getting into nicer weather, so you may want to allow people to go out, maybe sit in their car. I don't know, but what you want to do, that's really an internal thing that each facility would have to look at. But, if the weather gets nicer, or do you have picnic, have people allowed to eat outside? I mean, there's all kinds of things you can do like that. But that's what we've been doing anyway. I'm not conscious of shutting any break rooms or lunch rooms down.
Okay. I'd like to change the focus a little bit and talk about, we had a webinar last week, and the speaker talked about something called the new non-normal or new abnormal. And I'd like to talk about that because we're kind of in this period where some people think we've been through the worst of this, and we're sort of thinking about opening things up. And you kind of hinted at that earlier, that you were sort of reopening facilities. Does that present any unique challenges? And when you address that, one of the things that strikes me is that there are issues that might interfere with the COVID-19 response that relate to the general health and safety of the employees, right? So do masks fog up safety glasses, for example? Is that a problem?
Sure. Yeah. So again, we created a checklist, we're calling it. And again, some of you may have seen these, some of you probably have them, and it's sort of it's about 50 different items on there that we've asked all of our operations to respond and see what they, where are they at, how did this work, what do they see as the issues going forward. Safety glasses with masks, yeah, absolutely. People have never worn a mask before. A lot of questions are coming forward. Excuse me. The masks that don't have the valve in them. So we're getting a lot of those things, Chris, as we amp things up. Again, there's anti-fog solutions that anyone that's ever played hockey or, worn a visor or whatever, you can spray that stuff on. Some places already have cleaning centers in their facilities where they have safety glasses or safety goggles that'll have cleaning solution and the anti-fog spray. And of course, the weather, humid locations, they're going to fog up even with anti-fog. So yeah, we're dealing with all of that and those types of questions that are coming forward as we're starting to put this face covering and masks in play. Again, I think you need to be conscious of those exposures and apply a logical, common sense approach back to those, because we're not going to have all the answers. You're not going to have all of the what if scenario questions readily available. And I think, again, when other businesses are doing the same thing or putting in temporary measures, et cetera, it needs to be explained why we're doing it, why it's temporary. And that, a caveat to that, and this is something that we put in there, is, at no time is the wearing of a mask or a face covering, if that creates an exposure or a hazard in itself, it has to be evaluated on a case-by-case basis. So it's not carte blanche, but it is, Chris. But, you still need to follow your internal response system, because you're going to have issues What do you do if someone has claustrophobic? What do you do if someone has allergies? What do you do if, there's all of these what ifs.
Yeah.
And some creep into HR, some creep into medical, some creep into safety. So you need to have an understanding that you're going to have to look at things as they come at you, and you're not necessarily going to have the right answer right off the top of your head.
Can't predict everything.
No. Boy, if we could, we wouldn't have this COVID thing, would we?
That's right. Good answer. A couple kind of specific questions. That must be your phone going off. You're probably kind of shirking your responsibilities while you're talking to us, Joe.
Okay.
Fans, especially with summer coming, are you guys worried about circulation of air and spreading the virus with circulating air? Has that entered into your thought process?
No. I would say right now we're being optimistic that by the time we get into that hot air, and again, we haven't had anything come out of any of the southern locations yet on it. We do have a whole directive on fan use, and they can't be blown directly on people anyway, Chris, because of the exposure. But no, that hasn't come up yet, but that's an interesting one. I'll have to keep my ears open for when I get faced with that. But I think, again, from what we know, it can only, this virus and most of these COVID viruses can only be transmitted through liquid, so a transformation from person to person, through orally or through the eyes. So, a person would have to be coughing and everything else. So if they've got a face covering or a mask on, let's say, that kind of takes that exposure away for the most part, I think.
Okay. There's a person on, they're not asking a question as much as making a comment. I'm curious if you've done this. The purchase of handheld foggers, this goes back to my question about disinfecting or sanitizing a whole location if you had to. It sounds like you can buy handheld foggers, and this person says they bought one from Amazon. Is that something you guys have tried? Because it sounds like they were able to clean large areas with something like that pretty quickly.
Yeah, I'm sorry, Chris. Are you saying foggers?
Yes, handheld foggers.
Okay. Yeah, no, we haven't bought a fogger. I'm sure that it's been, somebody somewhere has looked at it. We personally have not. I have not. My team has not. I'd be concerned. I'd want to look at what you're putting in there.
Yeah, this person's saying they're using
as far as what you're putting in as far as your fogging, and
sure.
Again, I keep coming back to the cleaning and disinfecting guidelines that are there from the CDC and OSHA that make it pretty simple. And again, if that works for you, going to foggers, by all means, who am I to question it? I just get concerned about that. What are you creating? And with all due respect, you may have really good intention of creating a whole other issue. And how effective is fogging for this? I haven't seen a lot on fogging, so I'll have to defer. It's not something we've done a lot of research on.
Okay. All right, that makes sense to me. I got to be careful there. Let's talk about the future for a second, because we don't have more than about 8 or 10 minutes left. I'd like to understand whether or not you have, as a management team, talked about automation and how potentially automation might help you with situations like this. And that could refer to anything, Joe, automating of anything. Is that something that's come up at all?
Yeah, it has, Chris. And again, it's come about from looking at things like the thermal scanning, and we've got some very creative people. I'm sure that others on the phone call have got very creative people, and we've had people come forward with different concepts about even walking through like a tunnel that would spray, some kind of cleaning solution to potentially, clean you from germs. I mean, we've got a lot of this coming on. We have a location, part of a Samuel group that, has actually making some medical masks right now and providing them to hospitals and et cetera. So there's a couple of things that, we've come up with that in the future, for sure, are we going to, do we have it all mapped out right now? No, Chris, because I think there's going to be so much new technology that is created out of this thing as well, that, kind of wait and see approach. But we're looking at it. I think, trying new things. What is the old saying? Without deviation from the norm, there is no progress. So I think we're open-minded. Again, I know our procurement group is looking at stuff. We're looking at stuff. There's been some really cool things that have come across my desk. Disposable plastic shields, et cetera, et cetera. Is there a place for that going forward? Is there a place for enhancing, adding to your security? Let's say right now you've got facial recognition cameras. Are you looking at it? Yep. Is there a way you can embed thermal imaging into these things? Is there a way? I think it is going to have quite an impact in some ways because businesses and manufacturers and people like ourselves have been, in the last few months, having to come up with ways to do things. And maybe there's been some really good things that are like, wow, that's a great idea, and you want to explore doing it. I think it's going to be really interesting, like the automotive guys, that are starting back up this week. I mean, I wonder what they've done, and so I think we're going to get ideas and concepts. And again, I think we're going to get inundated with more. And I think from our perspective here, we're always looking for ways to improve, and I'm sure everybody else is. And it's just a matter of, does it make sense to do it? And you're going to have to evaluate it at your business and under your culture and see, hey, do we want to spend, 10 grand on this? And if you spend it, what are the benefits and what aren't the benefits? So looking at it, doing your hazard assessment, doing your whatever, and see if it makes sense. But yeah, I definitely think there's automation type ideas that are going to come out of it. And I think most of us already look for ways where we can minimize exposure anyway. So yeah, I expect there'll be a few, Chris.
Okay, so last couple questions, because we're running out of time, but I'd like to take a minute to talk about working from home. You mentioned that very early on when we first started talking. Do you think that's going to become a norm in the future, now that everybody's kind of gotten used to it? And what has been Samuel's experience with that for the last month and a half or so?
Sure, great question. So that's one of those unknown things. We had a work from home policy that, again, fortunately we'd gotten in place, and again, around inclement weather and all of that. So we had a work from home policy and procedure and how it all works. Again, we weren't planning for this scope. I think our IT folks did a great job of making it work. I do think that, again, it's something that is definitely being looked at, because there's obviously, if you're limited spacing and, even logistics for some people, and, how viable, do they need to be in the office, that type of thing. Yeah, I definitely would say we're looking at it. I do think, I know my team, which, they're all working from home, and I'm only in the office because our plant's open, and so I'm here, and somebody needs to be here to do certain things. So, but I know my team is very dedicated safety team, and it's driving them nuts working from home. Mm-hmm. They want to be in, and they miss his social interaction, and that's a big part of it as well. So I think for Samuel, for us, definitely looking at it. I'm sure, again, there might be benefits to it. And it might be something that we look at doing, hey, if you end up you were asking me, Chris, about, pandemic planning and that. Well, maybe that's something that's implemented, going forward when we have a situation. And it could be something else, right? It could be, again, hopefully we never get into it, but some other external thing that, you know, creates a hazard for people getting into work for whatever reason. So I would say it's being looked at and will be looked at, and yeah, there's possibilities there of saving people money. You know, you're not burning as much gas. If we talk about a green incentive, you could tie it into, you know, your environmental portfolio. Hey, think about how much, you know, green benefit there would be of people not having to commute every day into work. So yeah. I think it's gonna be an interesting topic going forward for sure.
Okay, well, we're out of time. Joe, I want to thank you. You've been very generous with your time. I know you're really busy right now, so now isn't the best time to ask you for a solid hour, but you gave it to us anyway, so many thanks. I want to tell folks who are listening in today that within 24 hours, you'll receive an email from us, MSCI, that's going to have a link in it to a post-webinar survey. We ask that you complete that survey because your feedback on these webinars that we're doing is really important to us. And we rely on you to help us make these webinars better by completing that post-webinar survey. So this has been one in an ongoing series of webinars that MSCI has been presenting, and they've all featured relevant aspects of the COVID-19 pandemic. And on that note, next week, on Wednesday, May 13th, we're doing another free webinar that's called COVID-19 Getting Back to Work Safely. And that's going to feature an MD and some folks who are senior safety folks from Optimum Safety, who is also an MSCI member and a partner who Joe knows very well from our safety committee. So watch for promotions about that coming up. In fact, one's going to go out in about 2 minutes. You'll be receiving that. So on behalf of Joe Galasso, Samuel Son and Company Limited, and MSCI, I want to thank everybody for listening in today. I want you all to have a safe rest of your day and stay well, everyone. Thank you.
Thank you, Chris. Hope I was of some help to everybody.
Much appreciated.
Take care, everybody.